Hello, everyone. Hello, good morning, Dallas, and good morning to all my global viewers. And this is your host, Anu, and welcome to my show, Global Gupshup, an iAsia news presentation. And thank you so much for joining today. And hope everyone is doing fine, well, keeping yourself safe, and having a great and relaxed weekend as well. So, like all we know, as the pandemic has taken over, there has been a significant transformation of human life, as we all can say. And we all know that, on March 13th, 2020, the United States here declared a national emergency in response to the coronavirus disease, 2019, COVID, as we all know, and pandemic, and followed by like many countries also globally have announced the national emergency as well. This one and crisis has caused a enormous negative impact on human life, health, economy, as well as even in national security, as to speak. We faced it all throughout the world. Well, let me tell you, folks, certain things, like many things can be halted, but we may not have control over absolutely all natural life events. I hope you agree with me because can you imagine how it's like to give a birth during this COVID? It's easy for us to say that it's okay, but I can only imagine exciting and nerve-wracking at the same time because it can be stressful and also it can be joyful as well. And like the parents go through so much of a turmoil. At the same time, it's happy and also the concern. So today's show is all about that, and let's talk about many questions and concerns of a this issue for expecting moms as well as new moms and newborns and children with our special guest who's going to be joining today, who is a pediatrician and also neonatologist. And that he actually completed his medical school in Hubli, Karnataka State, KMC, India, and received MD in pediatrics in Chem Hospital, Mumbai. So he went to United Kingdom for his higher studies and completed diploma in child health from Glasgow Royal College and MRCPCH from Royal College of Physicians and Child Health in London. He came to USA in 2002 and completed his fellowship in neonatology, and ever since that he has been practicing here in USA. He has two children, and he is running a nonprofit organization here with his wife Sumana Nandan Dacha, Train and Help Babies, which is serving currently many areas and with a lot of projects as well. So it's a pleasure to welcome Dr. Kabur to my show, and we are very excited to have him. Dr. Kabur.
Thank you, Anu, very much. I'm very happy to be here, and I would like to wish all our listeners a happy Gauri Ganesha festival. So you are just in the middle of the very important festival in India. And at the outset, also, I would like to thank iAsia News and Anu yourself for organizing this, and also our organization Train and Help Babies for giving this opportunity and to represent the organization on behalf of this. I would like to thank, as you mentioned, Dr. Sumana Nanjundachar for helping with a lot of research and other things, and all the board members. And as you mentioned, yeah, it's a very important topics. I'm very happy to share my experience and knowledge about this current pandemic.
Thank you. It's a pleasure to have you. Um, so this is really a great opportunity for all of us to learn about this topic. But before we even go to the discussion in deep, So ever since the COVID has started, we have been learning so much about information about this virus, how it is born, where it, what happens, and like so much about it in every, like a newspaper, news channels, like all the social media. And so I think it's a good idea to hear and learn about it from an expert. So let's start with talking a brief intro about this virus.
Definitely. Yeah, I totally agree with you because ever since the World Health Organization declared that it was a pandemic, since then there's a so much information overload, especially for the media. You open any news channel, you open any social media or TV, everywhere there's so much news. So it's become like a news fatigue. So it's important that we hear the salient features, what are the latest updates. So having said that, let me begin a short intro about these coronaviruses. There are many few coronaviruses in circulation already. This is not something totally new, that coronaviruses. There are about four families. Just to give a short information like alpha, beta, gamma, and delta viruses. So of those, this is a beta coronavirus, and these are present in bats, rodents, and humans. So the first coronavirus happened sometime in 2002, that SARS thing. Uh, and then the second one was in 2012, which we called it as MERS, Middle Eastern Respiratory Syndrome. And this is the third one, kind of. This is a SARS-CoV-2, like COVID virus 2, because it happened in 19. So that's why they call it as SARS-CoV-2, like COVID-19.
So this is really a great opportunity for us to learn about like something more important other than just the virus that is actually happening, because the impact that it has made, especially on the newborns and the pregnancy, as well as a lot more other things that we are actually going through. So let's say. Like you said that in the beginning, I did mention about some things that are beyond our control, and
Hmm.
but if they can, just let's assume if they can, is this a wise idea to wait to get pregnant until the this pandemic is completely gone, or just to be on the safer side? What do you say?
I know it's a very, very important question. But as I said, since this is a totally new virus, as we say, it is a novel virus, right? So what
Mhm.
novel means, the virus when it's divides and then or replicates, and then the particles come back and join again, and then they kind of form a newer virus. Okay, and this virus was also not identified in the past. So that's why they keep saying that it's a novel virus. So when the pandemic is happening and the virus is spreading so fast, so everybody is at risk, okay, including the pregnant women. Since the question is about starting a family, so it's a very, very important decision that you have to sit, whoever is planning to make the, like, start the family with your family members. What are the pros and cons? Because like you take example of World Health Organization or CDC, Centers for Disease Control, or any of the local government or hospitals, researchers, we don't have a clear-cut answer as to what are the effects on a pregnant mother or on the baby.
Mhm.
For example, for pregnant ladies, as we know, so it's a kind of immunocompromised situation because the
Right.
mother has to accept the
Hmm.
fetus. It's like a foreign body, right?
Right. Right.
So
Hmm.
once that happens, that immunocompromised status itself can kind of put the mother at risk for
Hmm.
higher complications or more severe complications. Anecdotally, that we have seen some mothers having, this is called a cytokine storm. So
Hmm.
they can have severe pneumonia, sepsis like symptoms, and they can go on the ventilator and have to be managed in the intensive care units. So
Wow.
it's not an easy answer. Yeah.
Hmm.
And fortunately, again, the question remains as such. like what is the risk of if the mother gets infection, if the mother is severe enough, what will happen to the babies? Yeah. So that's why, it's a very important decision, how soon you want to get pregnant and what are the other circumstances. So it's a combined decision. And keep waiting for the newer data to emerge if you are not in a rush, and then talk to your obstetrics and gynecologist and make a combined decision.
That must be a very critical decision for parents to make once you actually like give them that option, because it is kind of like yes or no situation, and both of them
Mm-hmm.
have risks at both ends. So,
Mm-hmm.
and also I've heard that is this true that like the pregnant women are more prone to or a risk of getting the corona infection, compared to the just the common population that as we consider. Is this true at all?
Yeah, as I mentioned, so pregnancy is kind of altered immune status. So
Right.
that's why it
Mm-hmm.
may put them at a slightly higher risk. But
Mm-hmm.
fortunately, we are not seeing that many deaths or that many ICU admissions for all pregnant women. So we have had cases where the pregnant ladies are asymptomatic also.
Okay.
Okay. Yeah. So that's why but
Mm-hmm.
still the compared to the general population who have like their, if you compare their age group and the healthy population age group, so
Mm-hmm.
they may be slightly at higher risk because of their altered immune status.
So, is there any way that you can early diagnose these pregnant women that so they're already exactly just for example, how much is the rate of risk at what month, like a first, second half, like the or the third trimester that they're going through? Which one is the highest risk as we to speak?
Yeah, it's a very important question because the fetus, if it gets infected, the
Mm-hmm.
major malformations happen if the infection happens in the first trimester.
Mm-hmm.
And the second and third trimester, most of the organs are formed. So
Right.
if the infection happens, particular organs may be involved, like brain, heart, kidneys, like that. But so far, because we are so early into the pandemic, we don't
Mm-hmm.
know the full extent of the effect on different organs. So it's only the time that if we follow these babies who are born to positive mothers, say for example, if the mother is in first trimester in March, if she gets infected, right, she
Mm-hmm.
is likely
Mm-hmm.
deliver after 9 months,
Right.
and then we have to follow that baby for next like 2 years, 5 years, 10 years, like that, to see
Oh,
what the effects may be, right?
maybe. Right. Right.
And if the mother is third trimester already, like she gets infected in June and delivers end of June,
Mm-hmm.
so that baby again we have to follow up 2 years, 5 years, like that. So what would be the effect? So
So,
it's very.
any
Mhm.
possibility of just any signs of the baby being any different in the sonogram at all than like even for a full term?
Yeah, that's another good question. So what happens is, so as I said, the data is coming, the research case series are also being published. So I found maybe about less than 5 case series about the effect of pregnant ladies. So pregnant ladies, so where they had, some of them had a cytokine storm and
Mhm.
they got infected, and then risk of prematurity in that case series was almost 37%. So that means one in like out of 10, maybe 3 to 4 mothers had gave birth to premature babies. So
Mhm.
we are seeing some effects, although when they tested these babies and when they tested the amniotic fluid,
Mhm.
those things were negative. So these babies were still negative, but
Mhm.
placenta showed some signs of inflammation. That means there was some infection going on in the background.
So, is there a special equipment or the process that is involved in just testing these babies whether they're infected or not? Any advancement that in that particular aspect of the finding out?
So far, we don't have any particular test per se for the newborns or the
Mhm.
fetuses. So
Mhm.
all we can do at this stage is we are checking on the ultrasound. So the
Mhm.
mothers need to go seek their obstetrician help. So
Okay.
one thing I want to tell our audience,
Uh-huh.
who are already pregnant, some of who are already pregnant. So if you feel any excessive tiredness more than you normally feel, or if
Mm.
you feel any changes in your baby's condition or your own health, like excessive vomiting or fever, any concern, so you take an appointment with your obstetrician, get checked. Okay, so this is a pandemic situation. We cannot wait. Okay.
So let's say that okay, so the newborn is infected,
Mm-hmm.
and like, and so what kind of a complications are we expecting? And I know you said that you may have to keep an eye on like 2 years, 3 years. So is there any immediate signs that we can observe in the newborns that so that we can actually immediately take some kind of an action or a precaution to take care of that?
Yeah,
You know,
sure. Sure. So especially that is kind of my specialty where I see newborn
uh-huh,
babies with
right.
when the mothers are positive. So
Uh-huh,
it is important that if the mother has symptoms, she should get checked so that we can take adequate precautions for the baby. Because what happens, there is a fear among pregnant mothers giving birth, right? So if I say I'm symptomatic and I say I get tested and positive, the
uh-huh,
baby will be separated.
right.
So I know, so it is important still, the baby may be separated, but nowadays the new data is coming. So as we keep saying that breast milk is the best food for the baby, so we are continuing to provide breast milk for these newborn babies. So we are
Okay.
not like isolating in two separate rooms or in the ICU like that.
Okay.
Okay. So
Okay.
again, breast milk may be still protective.
Uh-huh.
So the to answer your question about the how we can take care of the babies, we have to make sure that babies don't have fever, and then
Right.
if they have any other symptoms,
Uh-huh.
that baby needs to be separated and tested. Say suppose if the baby comes back positive, which fortunately so far, newborn babies across the world, I am reviewing the literature.
Uh-huh.
uh, I haven't found anything that the mother and babies both are positive at the same time, but there may
Uh-huh.
be few cases here and there
Right.
from some hospitals.
Right.
Okay,
Right.
so the management remains the same. So
Okay.
strict isolation, continue breastfeeding. Okay,
Right.
and then the pediatrician and the infectious disease specialist must follow very carefully.
You just mentioned about the breastfeeding. So I know that as mom, that how well
Hmm.
informed we are in the
Hmm.
new era, that how important and it's scientifically proven the colostrum is for the baby the first few hours. And so, is it safe for a mother to breastfeed the baby and still not get any side effects or any kind of infection?
No, not really. Especially we are encouraging breastfeeding.
Hmm.
Okay, 100%, because
Okay.
it's breastfeeding protects the babies, as we know,
Right.
in many conditions.
Right.
So this is more so for our audience, especially in the low and middle income countries, like developing countries,
Hmm.
where the risk of infectious disease is really high. So especially if the mother is really sick, that's an
Hmm.
exceptional situation. If the mother can breastfeed even though she has some illness or she tested positive,
Hmm.
so it is important she must continue, because the risk of gastroenteritis, pneumonias, and other infections for the baby by
Hmm.
giving supplemental formula is
Hmm.
more higher than
Right.
baby getting infected with COVID.
COVID. Okay. Yeah, that's an excellent information, Dr. Kapoor. That's really because I know a lot of mothers will be concerned that I'm infected, and then what if my baby is going to get sick if I breastfeed, and then
Mm-hmm.
completely
Mm-hmm.
misinformed. So that's a wonderful information to know all the moms. So I know that like the family support is a great
Mm-hmm.
thing for. Mothers, especially after the delivery and the postpartum and issues. And so, how can they support, and like what kind of a precautions that if they find out that she is infected, and like is there any specific way that you have a suggestion for them to take care?
Yeah. Again, so this COVID situation is something totally new for all of us, right?
Yes,
So we did
yes,
not read about it, we did not hear about this.
yes,
So I mean, we had heard about great pandemics in history, like some
No, sir.
documents.
right.
So here, what
काय
happened
इमर्जन्सी नसलं
initially?
तर थोड्या वेळाने फोन करतो सर.
So initially what happened was,
O2 नहीं है बेड, O2 वेंटिलेटर नहीं
oh,
सर.
I think we have to.
Yeah, I think. Okay.
Oh yeah, he muted. Okay. So
Yeah.
what we went through was, so when
Uh-huh.
the mother was tested positive, so then we
Uh-huh.
were wondering,
Uh-huh.
so what is the risk of baby getting infected, right?
Right.
Initially, we started isolating those babies in a separate room like that. But
Correct.
now,
Uh-huh.
so because as I mentioned, I'm going to stress on that fact again, that
Uh-huh.
breast milk is very important, extremely important. They must
Uh-huh.
continue.
Okay.
So the family member's role here is going to be, if the mother is sick, so we
Uh-huh.
will have to ask the mother to either use the electric pump to pump the breast milk and give it to the family member so they can feed the baby through a bottle, or they can, until the mother recovers, they separate the baby and take care of the baby completely
Right.
until the mother is asymptomatic and able to breastfeed. And it's important that we must, especially in India, our audience in India, once the baby
Right.
is born, there will be a lot of people to come and bless the baby,
Yes.
this
Yes.
ceremony, that ceremony. That thing, they must put a full stop.
Yes.
So
Yes.
absolutely nothing. Okay. So
Yes.
we have to make sure the baby and the mother should not get infection. So
Yes.
they have to hold on to that thing that, oh, I have to, neighbors will come and they see from the window, door, nothing. So they have to stop all that. One
Yeah.
cough is going to destroy the
Make
whole
a
thing.
huge disaster.
Yes,
Yes, I
yes,
agree with you.
yeah,
So, yes,
yeah.
totally. We do respect, by the way, to all the culture, tradition, and the blessings and everything. But, with this situation, I think it's extremely critical that we need to take care of that one first because safety comes first than anything else. And
Correct.
we can definitely do those rituals later. Excellent suggestion. So I know that, like we just talked a lot about newborns and also little pregnancy, new moms, everything. And everyone exists. I know like reborn, I mean like newborns are a bundle of joy. We all enjoy them. Such a sweet age to just to manage as well. But
Hmm.
also I think let's talk a little bit about children because as we all
Hmm.
know, who are right now just starting the regular school. Some of the schools are already announced that they are going to be restarting and they will be going to school pretty soon. So it's a larger concern of many parents as we speak that, as we know, a few schools already started and they, I mean, can they safely send their kids to school? Or, I'm talking about both here in USA as well as in
Right,
India. So,
right.
um,
Yeah. So as a pediatrician, it's a extremely difficult question to answer because this has multiple facets. So
right,
I have to talk like a pediatrician and I have to
parent.
talk like a parent also, right?
Yes,
So when it comes to even, my wife, Dr. Nanju Dachar, she's also, a parent and a
yes.
physician, like a pediatrics. So we will go through a lot of discussions on this one. Uh, So if we send, what are the risks? So I'll tell you, I'll divide this into two parts. One, so how the children get infected, and if they get infected, what happens? And
Right.
if they don't go to school, what will
Mhm,
happen? And if
mhm,
they go to school, what is the risk for the teachers and the other staff, right? So children, as I said, they carry a lot of germs, especially less than 5-year-olds. So they did studies in children who are less than 5-year-old, and they carry a lot of coronavirus if they get tested positive, right?
mhm,
But
mhm.
fortunately, I mean, you can imagine a 5-year-old is not
Right.
going to go around and infect everybody. They stay
Correct.
home, play in the house, may infect the family members.
Right.
The second set is in the was seen the
Uh-huh.
coronavirus volume, or the uh, no, viral load was seen in between 5 to 17-year-old. Okay.
Uh-huh.
So all it takes is, now I'm just kind of fast forwarding my conversation. All it takes is one baby in the classroom, right?
Uh-huh.
Or one
Uh-huh.
baby or one child, for example, coughing in the hallway, right? When they're changing the classes.
Uh-huh.
So there was one study which is very famously quoted in US. So when the kids went for a camp, which they all were tested about 12 or 14 days before the camp was started, they were all negative. And
Uh-huh.
once they entered the camp, there was one teacher who got infected, and he spread nearly to 76% of the people.
Oh my goodness.
They followed all strict precautions. This was a very well organized camp. They wore
Wow.
masks, they had hand sanitizers every few feet, and their activities were all settled. So, what I'm trying to say here is opening the school is not as easy as we say, okay, go social distance 6 feet, the desks are 6 feet away. But kids are kids. They don't worry so much about the infection. They touch their face, their mouth, and they eat. They play. So it is difficult. And then the second part that I wanted to bring to is if they are going to bring the infection to your home, right? Once they
Oh
get
yes,
infected.
absolutely.
So one thing I wanted to stress here is you may have high risk population in your house, right?
Right,
Like elderly
right.
population above
Yes.
65-year-old.
Grandparents. Yes,
Exactly.
absolutely.
So especially like they might be diabetic or heart condition, right?
Right,
Or some
right.
other high risk population. So
Correct,
that
correct.
puts them at risk. So in
Right.
that situation,
Not a good idea.
exactly, bigger house is different, like in US and other places. But
Well, I
in
mean, sorry to interrupt, but just,
yeah,
bigger house or not, I think like kids, like you said, kids are kids and you just
right.
cannot control them. And especially like,
Yes.
talking about, like we do have some special kids as well. And
Hmm.
I think especially for them, it's very difficult to explain what exactly it means to stay away
Right.
from one. And they might be monkeying around and just, spitting everywhere or just,
I know.
making fun of it, like just like what is
Right.
going to happen. So I
Right.
think it's really not a good idea, like you suggested. You're right.
Right.
So
But again, so I don't want to say to all the parents that continue only online, but wait for the new data to emerge, wait for the World Health Organization, CDC, or your local government, like Indian government, for example, to
okay.
come up with some data and then the solutions, right?
Mhm,
And then
mhm.
the other part that I wanted to stress upon is, if both the couple are working, right? And the school was a buffer for them, right? So
Right,
they drop
right.
the kid to school, they go for work. Now, if the kid cannot go to school, then one of the parents have to stay home,
Hmm.
right? So
Yes,
that is another challenge.
right, right, right.
So, I mean,
So
it's not an very easy situation here.
oh, I agree. And yeah, that's a great suggestion. And let's hope and that like everyone will understand the risk of
Mhm.
putting so many lives in danger and just wait until at least that we get some solution for that. So what
Right,
about young adults? Like I'm talking about like university kids or high schoolers that at least
right.
they have a better understanding of this one. Do you think they are at risk?
Yes. Because
Yes.
earlier, yes, earlier they were saying that
Mm-hmm.
children and other younger adults are healthy. But anecdotally, again, there are case reports, and based on what we hear from our physician groups, there are children who are in their teens and 20s and 30s. They are infected. They can go on the ventilator because it all depends on the genetic factors. Okay, so the best strategy is prevention. Nobody should take it like lightly and say, "Oh yeah, I am in the healthy population. Let me just." As you said, monkey around and then get infected. So you never know. Because I recently heard that even the 17-year-old got infected evening before. Next day, she went on the ventilator, and few hours she died, and she was tested positive. Okay, and then even military people, okay, in their 20s and 30s, they are getting infected and getting really sick. So it's not a good idea to even say, okay, yeah, teenagers, they are easy. They just get mild cold symptoms. Let's ignore and then keep spreading.
So
Okay,
everyone is equally at risk, so it is not even a good
right,
idea. So just stay away, keep distance, take precautions, and just don't
correct,
let that one spread at all. So
right,
excellent suggestion, Dr. Kapoor. And I know that we have several guests with us today that they also are eagerly waiting for us to invite them so that we can hear more from them. And they're also involved in this project that what THP, and they're all physicians who experienced from India. So I would love to just, invite one by one so that, we can have a great conversation and a panel discussion with them. So let me start with inviting Dr. M. Patil. He's a professor of Department of Pediatrics, the B.M. Patil Medical College Hospital, Vijaypur. So thank you so much, sir, joining and, like a congratulations being a co-investigator for a WHO action trial. So that's a global network class project, and it's pleasure to have you with us today. Thank you so much for joining.
Thank you.
And next, I'm going to invite Dr. Fatehpur. So he's an associate professor of pediatrics, Karnataka Institute of Medical Sciences, Hubli, Karnataka, and so he will be with us also. And thank you so much for joining, Dr. Fatehpur. So it's a pleasure to have you.
Thank
So,
you.
the next one, I would like to invite Dr. Basaraj Patil. He's a professor and the unit head of IMR Medical College, Gulbarga. Thank you, sir, for joining. It's a pleasure to have you with us, and we are really excited to have more discussion on this topic as well.
Thank you, ma'am. Thank you.
So, and let's, and I also want to invite Dr. I think we are going to be inviting Dr. Shailesh Patil. So I think it's a good one. The professor and head at the Department of Pediatrics, Belgavi Institute of Medical Sciences, Karnataka. So welcome, sir.
Thank you. Thank
And
you.
it's a pleasure to have you. Let's start our little conversation today with, so how is the situation back in India? So, like I would like to hear from Dr. Basaraj. So tell us that, how are we facing the situation? Is it still the same, difficult?
Yeah, it is still in a grim position. All ICUs and everything are running at full capacity. Maybe I think so. We are whether we are seeing the peak or the peak is yet to come, we don't know. So definitely, but the only silver lining in the whole thing is the case fatality is not so high as we witnessed in Italy or even US.
Right.
So the silver lining is the case fatality. So as part as this is one good thing that is happening there.
Right. So, so like what are the hotspots as we has to consider as such? Dr. Shailesh, what do you think? Like, is any concerns about the hotspots like right now in India that we need to be worried about? Can you hear me, Dr. Shailesh? I think he is.
Yeah, sorry. Yeah. Yes,
okay.
madam.
Is there like do you know any hotspots that we really must concern about in here where you are from? Like any concerns?
Earlier, there were few hotspots that were identified in the city of Belgaum, but since it's the community spread now, we are getting patients from almost every corner of the city and every corner of the district.
Right.
So it's very difficult to point out a particular area of wherein we are getting cases because they're coming from all throughout the district right now.
So being the border of Maharashtra and Karnataka, so do you have like I think that this is going to be a little overwhelming situation in Belgaum as such right now?
Yeah, actually we had anticipated that we would be getting cases because we border Goa and Maharashtra. So we had already prepared ourselves in with the infrastructure. Right now we are, as Dr. Basaraj said, we don't know whether we are at the increasing trend or we are at the peak. But we are still cases are being more and more every day.
Right. And Dr. M. Patil, so I know that you are from Vijaypur. So tell us that like how is the situation there? Is this also the same as other states or like in districts or like how are you facing it? Sir, unmute
Doctor, pardon,
yourself. I
unmute
think.
yourself. Yeah.
The
Thank you.
first case was in the month of April 12. Initially, we used to get only 30 to 40 cases per day. From the month of July onwards, we are getting 100 to 200 patients per day. You know that Bijapur is the border district. It is in connection with Maharashtra. We had
Correct.
a lot of the domestic travel. Nearly 25,000 domestic travelers entered Bijapur district, out of which are nearly 250 tested positive.
Right.
And situation is controlled, madam, because initially only one COVID hospital was there.
Right.
But our BAD University has given 300 beds to the public take care of ICU admissions and those who require oxygen.
Oh, okay. So let's quickly hear from Dr. Fateh with the situation in Hubli as well.
Since 1 month, 15 days to 1 month, there are a lot of cases. As Dr. M.M. Patel already told, earlier we used to have only 10, 15 cases per day. Now it's almost 50 to 100 cases per day. So it's already increasing, and I think it's stabilizing. I think the not more than 100 or 150. So daily we are getting that, and earlier it was only one KIMS hospital, but now many private hospitals, and their private medical college also has joined hands in controlling, in treating the patients. So as of now, though many hospitals are there, but almost all hospitals, the patients are full. But somehow we are managing and treating all the patients of the
Wow,
COVID
that's nice.
in our
That's nice.
district.
Let's invite Dr. Lade also, that since he is from Maharashtra, Vivekanand Hospital, Bomnali district. So thank you, Dr. Lade, for joining. It's a pleasure having you here. So we were talking about the situation in all the Karnataka, Maharashtra, Goa borders. So quickly, just to enlighten us a little bit about what's the situation there.
Yeah, thank you very much, Anu ma'am and Kapoor sir and TASB for inviting me, a person who is situated in a small village like Bamnoli in Maharashtra state. Uh, in Maharashtra, in Sangli district, the situation is not good from last 1 month. Daily, about 400 to 500 patients are becoming positive in Sangli district. The district population is about 25-30 lakhs only. And all hospitals, we have about 1,500 beds for COVID patients in our district. All beds, mostly oxygen beds and ventilator beds, are totally full, and we cannot take the patients who require ventilators, who require oxygen support, and it's a very tricky situation in front of us. Last from last few days. So there is a huge problem in district like Sangli in Maharashtra state.
Hopefully we will come around, and then we will just have someone that come and just help you out with that one as well. And it's nothing to worry about, because I know that whole entire world is going through such a critical situation at this point. And in all the physicians and all the medical facilities are going through this. And I think I'm glad that you expressed your concern about that. So Dr. Prakash, this one is I know that you have seen the situation in both countries. So tell us just update a little bit about the situation in US, because I know that in especially state of Texas, we had a little higher numbers from the last 2 months. So, and hopefully it's coming down, and any hope for a solution?
Yeah, definitely. Yeah. So as you see, the pattern here is extremely important. What is
Right.
important here is doesn't have to be like a developed country or a developing country. See, I
Correct.
mean, the both countries are equally involved, right?
Uh-huh.
But
Uh-huh.
at least the resources are good in a developed country, so we can handle the severity of sickness and the patients,
Correct.
right?
Correct.
But one thing I really admire is how the people in India and the government of India has really worked and planned, and they shutdowns and everything, even with limited resources. So
Right.
all the people that they have worked so efficiently to
Uh-huh.
decrease the mortality and decrease the morbidity, it's really, really commendable. So that's why I'm so proud of all the faculty here and those who could not join
Absolutely.
in India. So that makes me so proud that I should continue to work with this faculty, and so much we can learn from them, right? So I mean, it's
Absolutely.
really important that the even with limited resources, knowledge, and the density of population, they're doing such a wonderful job.
Right.
So coming to the situation here in US, the pandemic is still not settled down. There is again people have become like immune to it. So oh yeah, 800 deaths a day, 1,000 deaths a day, who cares, right? They go back to work, come back like that. But it is very significant. So I just was reading, if somebody says like, oh, there was a tornado and ripped off like 50 people, that becomes a huge issue. Imagine
Right.
like
Right.
1,000 people are dying every day, so we are
Right.
just ignoring it, right? So
Right.
that's
Oh,
the
absolutely.
sad part. But it's important that we need to continue to be aware of the situation and then continue to take all the precautions. And in Texas,
Right.
per se, the number of cases are still high, but the case fatality, as Dr. Basaraj was saying, it's slightly better compared to other states like New York or New Jersey.
Right, right. So that's really good to know that. And like, and also the second half of my questions was like, so any hopes for the solution? So that are we expecting any good remedy or the vaccine that's coming soon by any chance, so that we all are curiously waiting for that.
Yes. So as far as the vaccine goes, as I mentioned, the developing the vaccine for this virus is challenging because it is similar to like a flu virus, right?
Mm-hmm.
So
Mm-hmm.
last year, for example, flu vaccine was only effective about 29%. But
Correct.
if large population of takes the vaccine, then that 29% becomes a huge number, right?
Right.
Compared to
Right.
like only smaller portion taking. So similarly, if the vaccine is also developed, so
Right.
unfortunately, the developed countries are going to get it first because they invested so much into it,
Right.
right?
So, and also, I
Um,
believe you mentioned something like a senior citizens are the first one to
Correct,
get the
exactly.
advantage of
Yeah,
that, so that
right,
they can be at the higher
right,
risk of that.
correct.
So
Yeah.
this is a great news, and let's keep our fingers crossed that it's going to happen soon.
Yes.
Because
Hmm.
that's like, with all the things that we only used to hear about the plague, that in what this similar kind of a pandemic that happens like 100 years ago, and so now we are facing it, and it's unimaginable the damage that it's causing throughout the globe. People are kind of like has to change their entire life
Mm-hmm.
for just
Mm-hmm.
one invisible creature. So it's not even a
Mm-hmm.
creature, I believe. So,
Mm-hmm.
so let me go back to Dr. Basiraj. I have one more question. I know that we are doing so much effort in different districts, different states in India. So I want to get input from all of you from different part of the, like the state, that even after that, like, what is it that, like, that needed to be done? Like, why is it not coming under control? That is there a specific concern that you have that you want to express, that that needs to be immediately addressed, either by the government or by the public?
One thing is that people sensitization, like having a mask, maintaining a social distance, hand hygiene.
Mm-hmm.
This has to come. The whole thing has to come in the community.
Mm.
That only that can means reduce the infection and also the transmission.
Right.
If this part is not going to happen, definitely we are going to have increased numbers.
Mm-hmm.
I think so. It is. I think so. Even in India, or you take USA, social distancing and wearing of the mask. I think so. It's not much practiced. Only in the lockdown periods they were practicing. Now they have even left those practices, and overcrowding. So all those things has to be taken care of, and then we can definitely we can have a controllable infection.
Right.
And we
Right.
have to wait. We have to buy time for the vaccine. So
Right. Right.
vaccine is not going to come immediately. So until vaccine, these are the only three measures which has to be taken care of.
Mm-hmm.
Correct. Correct. So,
Yeah, I
and
totally agree. Yeah.
yes, absolutely, it's necessary, and
Mm-hmm.
I'm hoping that everyone will practice that one in their day-to-day lives to make everyone like around them safer as well. Dr. M. Patil, so I have this question for you that I know that there are so many different Ayurvedic medicine or like all these other things that are being offered. So as a home remedy. So what do you think about those things? Do you think they're effective, or have you recommended anybody that, and then just probably that they worked, not worked?
Ma'am, as long as they maintain distance, as long as they stay home, they can continue to practice these things. There is no problem. If they practice only these things without maintaining the distance, without isolating themselves, without coming forward to test themselves when they have got the symptoms, is bad.
Right. Right.
And people here, they think that it doesn't happen to me; it happens to others. They think that
So
it doesn't happen to me; it happens to
So you
others.
think
And
because of that, the home remedies, nothing will work out if as long as they just don't the
yeah,
first line of barrier is not maintained. So
yes.
that's wow, that's really yeah, important message. I think I hope everyone is listening and everyone will help each other to maintain that one. So Dr. Lode, this is another one. I know that it's rainy season there, I believe. Am I correct? So how do you manage
Yeah,
from the other infections that are happening on top of this virus?
yeah.
Uh,
Definitely, this is the rainy season in Maharashtra, Karnataka, also, and in India.
right,
There are other infections like dengue, chikungunya,
right.
viral infections, influenza, and flu. All flu infections are there. And in rainy season, there are huge infections in India. So there are some COVID hospitals, COVID OPDs,
So
and
yeah.
other general OPDs and general hospitals are there.
Uh-huh.
Other infective peoples are going to other OPDs, general OPDs, and COVID patients are coming to the COVID hospitals, COVID dedicated hospitals. Vivekananda Hospital is now a dedicated COVID hospital. So all the COVID patients and suspected COVID patients are only coming here, and we are admitting them. We are taking swabs. We are doing all the investigations, and we are treating them as a COVID patients only in Vivekananda Hospital. We have started a small unit to other peoples in Bamnoli village today.
Wow, that's good to know because I know that it's very important to separate those from the and effort has been made for like a separate infected patients as well. So Dr. Fatehpur, tell me, I know that in like Dharwad, Hubli, Belgaum areas, there might be even a bigger issues with the recent flood that happened. So how are we controlling that one, especially like in the like today's discussion that what we are talking about, like the new mothers or the babies or newborns, like how are we keeping them safe?
Flood situation in Dharwad district is not so much. It is in other districts like Bijapur and Belgaum. So
Mm-hmm.
in Dharwad, flood situation is not there, but rainy season and a lot of, as Dr. Ram said, there are a lot
Mm-hmm.
of other infections like flu, dengue, and all are coming up. So
Right.
in children, it's because the chance of infection in children is little bit less and also the mortality is less. We tend
Right.
to diagnose other disorders rather than COVID. But in
Right.
adults, because of the extensive spread of the COVID disease, any
Mm-hmm.
person, adult person, irrespective of any other suspicion of disease, first we have to diagnose him as the COVID and send him for the swab testing.
Correct.
Apart from that, the neonates and all, it's already in KIMS. Around more than 60 deliveries have already occurred with COVID positive mothers,
Wow.
and
That's to know.
none of the child had any problem. We had
Excellent to know.
we had roomed into the mother side itself. They were breastfeeding with precautions like having mask and all. And some of the we usually take swabs on day 2 of the life,
Mm-hmm.
and some of the babies became positive also, but we did not treat anything and they went home without any problem.
Right. Right. So yeah, that's excellent to know. Wow, that's amazing. That it's very encouraging to know that mom and babies are safe to have. So let's invite Dr. Pavitra also. I think please put her in. So so she has worked with the COVID patients and also the the newborns as well. So it will be a good input from her. And while she's joining, I have a question for Dr. Basiraj. So
Yeah.
when we are having a this like the double whammy, like that you have a COVID patients, we have another infected patient, and also this you have to be extremely careful about these the expectant moms and everyone else. So I mean, are there going to be a lot of risks that can be, like for them to be concerned about, like in whether do's and don'ts, like, how do you manage to keep them separate, even though it's a totally different hospitals, but, the medical supplies or mix up. So how do you manage that one? Is this difficult?
Yeah. No, actually, this whole policy, IAPIC had a policy about this only, wherein separating the mother and the child. Separating the mother and the child up till 12 years, both have to be roomed in the same place rather
Right.
than separating. Yeah, that causes a lot of emotional disturbance. So there was a recommendation that both the mother and the child has to be at the same place. It has to be admitted at the same place. So that ethical issue and emotional issue was also taken care of. So now I think so everybody is practicing the same thing, wherein the mother and the child are admitted in the same place, even if they are both are COVID positive.
Right. So that's a excellent idea, but I know that certain areas. Dr. Krishna, can you add Dr. Shadab? So I think we would like to hear from our the freshmen said, like the just one that we can actually get some feedback from them as well. Let me see. Are you there, Dr. Shadab? Are you there? I think.
Yeah, can you hear me?
Okay, there we go. All right. Thank you for joining. So tell us,
Yeah,
like,
thanks a
what's
lot.
your experience working with the COVID and also the new moms and the babies? I know that the pediatrics is challenging at this point right now. So tell us, like, what do you think? How is your experience?
Yeah, first of all, I would like to thank Aisha News and Train and Help Babies for giving me this opportunity to share this platform
Absolutely,
with
pleasure.
such esteemed guests. So, as Dr. Kabusra already mentioned, this is a new situation. And because this virus is new and this disease is new, there are lots of uncertainties. And therefore, initially, it felt very challenging and daunting. But what was surprising that together as a team, we could excel beyond whatever we had thought or imagined possible as individuals. And so the main issues that we faced was uh, having to manage three separate sections of the hospital. So initially, we used to treat patients of various diseases. But once this pandemic started, we had to run this hospital in three separate sections. So one would be the non-COVID patients, then second would be the suspects, and the third would be COVID positive patients. So the
Right.
challenge was in setting up in our existing infrastructure three separate sections with all the facilities that we used to offer before. So we needed separate NICUs, separate pediatric wards, separate SARI wards, and dedicated PGs and nursing staff to manage those areas. That did seem really daunting in the beginning, but we surprised ourselves and we came together as a team and we were able to. I feel that the worst is behind us now. The second
Oh,
challenge
that's good to know.
was that educating patients is education, in our case, the parents of the patients, is also a challenge. What I noticed was there were two extremes. There were parents who were very worried, and then some who were not worried at all. So it was necessary for us to take some extra time in educating these parents in having a balanced approach so that they could take the necessary precautions, also go about as much as possible with their daily lives, but also take the necessary precautions. So what I felt was that this idea of working together and going the extra mile in educating these patients and their parents uh, really boils down to the ethos of train and help babies, which under the guidance of Dr. Kapoor sir and Dr. Fatehpur sir and our senior faculty in KIMS, we were able to come together and work.
That's a excellent feedback, Dr. Shadab. So it's good to know that I hope you all continue to support and then the continue this wonderful project that Dr. Kambur has started, and especially in here the VNRIs are excellent support as far as those projects are concerned. So let's say that once that now that we are facing all this. The difficult situation with the children. So I know that Dr. Kabur talked about the social distancing and all that. So what is it that causing, what is the impact that is making in children? Because, like all of a sudden, like absolutely no going out, no contacts, and like especially these team sports, nothing. So how are we managing it? Like, is this causing a lot of stress and depression in children? I think I'm going to let Dr. MM Patel take this question. Sir, can you unmute yourself first?
Hi.
Thank you. Yes.
Really, there is a tough time for even parents as well. Keeping small kids at home, managing is a tough time, madam. Because they like to
No
go
one knows
out.
other than all of you. I know that.
It's a tough time. And here in our India, we started online teaching programs, but many of our parents are not so much educated to deal with such a problem. And really, the parents are facing a lot of problems. And another one more challenge we as a pediatrician facing is they are not coming forward for routine immunizations. The last 4 to 5 months, our routine immunization has gone down. So people are now we don't know whether they will come up with the measles and diphtheria.
See, a lot of people do not believe in getting their kids vaccination done because they're kind of like do not believe in, like, instead of having that the vaccination protects them, they think that it's harm. So maybe that could be the reason, and then including this virus. Do you think that has anything to do with also, Dr. Prakash?
Yeah, no, I was just waiting. I just unmuted. And I would like to take this opportunity, and I would like to one thing that extremely important take home message is, as Dr. Patil said, immunize your children on time, because we do not want a second epidemic of measles or mumps or any of those things, whooping cough, diphtheria. Okay, so whoever is logged into this yeah, very special event, so go back and educate all your neighbors, parents, all your WhatsApp messages. Instead of good morning, send a message as vaccinate your children, right? So that is what is going to make a huge difference. I mean, you can say like
Absolutely.
patriotism, all that stuff. I think
Right.
the patriotism comes in these kind of messages, right? Dr. Patil,
Absolutely.
you all agree? Yeah.
Yeah,
Yes.
definitely.
Unanimously, of course. So absolutely agree. And so,
Neha is
well,
on, I think.
welcome, Neha. It's good to see you. So I can see you right on time and on duty. So thank you so much for joining. Uh-oh, I think we lost her for a moment. So I'm gonna touch a very sensitive part of this right now. So for all of you, feel free to say what you think is. I know that a lot of families are hesitant, kind of like are not willing to take the first step to move forward and just admit that okay, someone in the family has COVID, because in case if something, God forbid, nothing happens, but in case if it happens, then they're not going to get their loved ones back, especially the dead bodies. So is this the hindrance that is actually also one of the causes for the more infection among the community? Yes, go ahead, Dr. Basraj.
Yeah, initially this social stigma was very much higher.
Okay.
As the day went on, everybody, but the neighbor got positive, many doctors getting positive and everything, and the whole thing has crept in, and they have absorbed into the system now that COVID is here to stay, and it will be in the community. So everybody is now accepting COVID as their, I would say, neighbor. So now the people have moved on to a next level, wherein they are accepting COVID also. So that acceptance is coming. Initially, it was very much a very tough time.
Right.
Like a family were getting infected and neighbors, others having a little bit of a totally isolating them in the community.
Right.
But
Right.
now I think so they are accepting it.
Yeah,
So,
Anu, I'll just answer just
yes, please.
one or two lines. It's a lot of
Okay.
ethical issues.
Right.
Imagine where the parents are not allowed. I mean, like not the parent, the children of the
Children.
elderly parents. When they are dying, even that situation, they cannot even touch their, hold their hands to say goodbye, right? So it's an
Right.
extremely emotional and a
Oh,
disturbing
absolutely.
situation. Yeah,
Right.
these kind of things, this entire family have to live with that,
Of
right?
course.
How they're
Yes.
going to, how that person might have felt seeing
Right.
the
Right.
immediate family member, grandchildren, children from like few feet away without even say like touch them and say goodbye, right?
Yes.
So I mean,
Yes.
it's a very emotional thing, highly ethical thing. As Dr. Basaraj said, people have accepted it, but it's
Right.
only the person who is leaving he can express, right, how
Huh.
he's gonna feel without his friends and family close to
Uh-huh.
them.
Okay.
Yeah.
So,
I,
any comments, Dr. M. Patel? I want to hear from you also.
Hello.
Yes, go ahead.
Initially, the people were afraid of the seal down. They think that once they declare that they themselves are positive, and they are afraid that the area will be sealed down and people will leave them off. All those things were there. Now, off late, and since the mortality is being so low, and people are having a lot of faith now in our health system, they are coming forward now and they're declaring their status. It's okay than it was there 3 months ago.
So, that is good to hear. And Dr. Fatehpur, do you think that number also is increased in your area? Like, are we still dealing with that situation?
Ah, definitely the cases are increasing, madam. Earlier, people used to hesitate to come to hospital also. Even they had symptoms, and many deaths used to occur in the home uh, because don't come to even even though they
Right.
had fever, weakness, and all. There is one syndrome called happy hypoxia syndrome. Though they had severe
Mm-hmm.
hypoxia due to pneumonia, they they used to just felt some weakness and used to stay, because if they come to hospital, they will
Right. Right.
they will get COVID. So
Right.
many deaths have occurred in home also. But now situation has uh, awareness is very much is there, and many patients are coming to approaching hospital, and now they are also getting fear of now COVID fear is, though it is not there, but once they get any
Right,
symptoms,
right.
they
Well,
definitely
it's
approach the
good to know, and
hospital.
I hope this fear, well, I mean, like, we are all educated, and I hope everyone will get over that fear, because it's a matter of the safety, and they will come forward to, just get treated as soon as they find out. So that's the only way to prevent from getting, infected. So, Dr. Prakash, I have another very unique question that I need to address is, like, I've heard about the herd immunity, so
Mhm.
what is it? And then, and I mean, tell us a little bit about it, like what it
Yeah.
is, and then.
So herd immunity is something which any infection that spreads in the community, so it infects people, right?
Right,
So
right.
people get infected, they develop immunity. That means they develop the effective antibody level to combat
Okay,
the reinfection, right? That's
okay,
important.
okay. Sure.
So, for example, measles, mumps, okay, hepatitis B vaccine, so other things that we take, the
Mm-hmm.
antibody level has to be effective and it should last long. So
Right,
that kind of immunity, that if it happens in the community, so that we call it as a herd immunity. So epidemiologists come up with a certain number for different infections.
okay,
For COVID, we don't know it because,
okay.
especially in
Yes, we
Europe, for
don't know.
example, in London, right? London School of Epidemiology, they come up with a number which is different than what the US epidemiologists are saying. So, for example, because COVID has a high case fatality rate, right? Imagine compared that to flu or other things, the case fatality rate for COVID is pretty high. So that means we have to have the herd immunity slightly higher than the other infections. So that to give you a number, it could be between 40 to 50%. But one thing I caution for the medical community as well as the other public is to achieve that herd immunity, we cannot ask people to go get infected. Let people be infected, right? So if we do that, it will be a disaster. That will cause very high mortality in the community. The resources will be very much utilized, overrun, yes. And even the risk of healthcare professionals getting infected and dying is pretty high. So we now need to be careful. But on the background, if the herd immunity happens, that is golden. We accept it.
So do you think we have reached that effective herd immunity against the
No,
coronavirus? No.
no.
No, no,
Even
no, no, no.
even with, say, I mean, I will tell you about the US population, 340 million or so, right? Even if we get 100 million vaccinations by December, all 100 million takes it. It's only one third. Still, it is not enough. I mean, we have maybe about 5 million. We are still so far away. I mean, imagine for India, population of 1.3, 1.4 billion. Yeah, it's still a long shot. But as I echo what the faculty is saying, the social distancing, mask, all the other measures that the governments and the health officials are saying, they are golden. Okay.
I think Dr. Pavitra is here, so let's invite her
And
in. I think we didn't get a chance to talk to her. Pavitra, can you unmute yourself and your
Dr.
camera
Neha is
also, if you
also
can
there.
hear me?
Yeah.
I think both Dr. Neha and Pavitra are here, but we cannot reach out to you. So just unmute yourself and Dr. Pavitra, can you hear me? Looks like we have a little bad connection there.
Yeah,
So
network issue.
let's wait for them, and I hope they will be able to join us because we'd love to hear from you all. And so let me ask you one more very interesting question about young adults and the children. So I know that we all get suggestions from our physicians and counselors, and then they say that okay, just do something alternative for children to keep them busy with the different activities, or just send them to camping, or so what do you think that is that is even safe, or do you think that will reduce make any changes in the situation? So I mean, I'm going to ask Dr. Shailesh to take that question.
Yeah, definitely. If as the most important cornerstone to prevent this infection is social distancing, and with the camp, if those things are not being followed, then it could be a focus of infection there.
Okay.
Yeah. So.
Oh, there we go. Hi, Pavitra.
Hi, ma'am.
Okay. Please stay with us. So let me finish. Let me have Dr. Shailesh finish this, and then we'll come back to you. Yeah, go ahead, doctor. Yeah.
Yes.
In my case, even I am a parent. Initially, we had both me and my wife had a problem to manage my kids, but right now they have learned a lot about online teaching, and they are attending online music class. So whatever their hobbies or their interest, which they were not able to do because of the school, and they are able to do it now. So
awesome.
they are quite happy
Excellent.
now, and
Excellent.
their full day is occupied now.
I think that's good to know. I think I'm going to let
Yeah.
all of you that suggest. So let me start with Dr. Pavitra. I know that we didn't have a chance to talk to her. So I know that you have worked with so many, the little ones when it comes to COVID. So tell me about your experience briefly, and then also, do you think it's a good idea to keep them busy with your favorite activities that you would like to suggest for parents? Pavitra, can you hear me? Can you hear us? I think it's frozen. I think network problem is and apologies. So
Yeah.
I'm gonna have Dr. Kabur take that question quickly, and then I'm gonna go around so that that way we can have more ideas for parents to share.
Yeah, Anu, just repeat the question. I was just focusing. Sorry.
Okay, definitely. I know you all are pediatricians and and specialized in a lot of different areas of that one. And I know that how hard all the parents are dealing with this situation in a different ways. Like working parents, non-working parents, or like it's difficult to keep them busy. So is there one
Hmm.
of your suggestion activity that can keep them calm, and also because everything is happening virtual right now, because nothing
Correct.
is
Yeah.
outside,
Yeah.
whether like and also
Right.
it's a safety concern risk. So what is
Right.
that you would like to give one solution that parent can follow to keep them busy? That I'm going to ask this one to
I'll
everyone,
tell
but
you
they
the
want to
one
think
thing
about it.
one thing in a funny way is
Yeah,
be a kid with your kids,
be a
right?
kid. Oh, that's excellent. I mean, we all should. Yes, absolutely, I agree
Right.
with you.
I mean,
It's
because
your stress reliever too.
I know because as much as we as parents, we always
Mhm,
show them the stick, right? Do this,
mhm.
do that,
Right.
kind of, right?
Yes, yes,
Because
yes.
we never see the world from their view. Because
Mhm.
imagine for their age how we were. We were constantly outside, playing outside,
Correct,
doing this, doing that,
correct.
coming late at
Right,
home. Yeah,
right,
we had friends and other things to do, and parents were not sitting on our head all the time.
right,
But now the situation is different. They are
right,
constantly feel that we are constantly watching them, constantly bombarding them, asking
right,
them to do the way we think is right for them, right? So
right.
it's important that we need to understand, come to their age and then play with them, make sure that they also understand us better. I
Understand
mean,
the
one side
situation.
of the story is it has given us the opportunity to spend more time with the kids, but at the same time, it has given them, taken away their opportunities of playing outside and having their own peers to have fun. Okay, so get them engaged. That's all I can say. Keep them
Right,
engaged in a fun way, what they
right,
like,
right,
rather than what
right,
we like them to be.
right,
Okay.
right. Dr. Pavitra, can you hear me? Pavitra, can you hear me?
I think no,
We have a very issue of a networking.
network issue.
That's
Yeah,
okay. Yeah.
yeah.
Okay. Dr. Fatehpur, go ahead. Take the same question and just give me briefly, like what is your favorite activity that you would like to recommend for a parent to take?
As Dr. Prakash Kapoor sir said, we have
Mhm.
to play with them. That is the best thing because
Uh-huh.
Okay.
now there is no school and all. They have plenty of time. Okay, and the children love playing.
Right.
So there is no other shortcut to keep them active. Like uh, otherwise, we have to. It depends on the age of the kids also. I have two
Okay.
daughters. One is bigger, she's seventh, and other one is just UKG. So I cannot ask elder daughter to keep reading books and other daughter to tell the same
Keep
thing because it's
playing.
very
Right.
difficult. So
Right.
it's better
Right.
we play with together with both the kids.
What? Right.
Then it will.
Right. So I think now
So
Dr. Pavitra is here. So can you hear me now? I can see you on the camera. Unmute
Unmute
yourself.
your. Yeah.
Unmute yourself.
Yes, ma'am.
All
Good evening,
right. So
everyone.
now we are excellent, excellent. So yeah, tell me
Yes,
what's your
yes,
experience?
ma'am.
Like I would love to hear from you as a youngster, just just joining. Tell me that
Yes, yes,
you worked with a lot of COVID newborns, and
yes,
so tell us like
yes,
what's your experience like?
yes, ma'am. I have just completed my post graduation. I'm
Mm-hmm.
thankful to train. I'm thankful to train and health babies for giving me opportunity to talk on share my views on pandemic COVID-19. I'm very happy that my
Absolutely.
teacher, Dr. Shailesh Patil sir, who is dynamic and he is here with me in this
Hmm.
situation.
Awesome.
I'm very yes. I would like to tell that government here is providing us with all the facilities, and the patients, suspected patients, are being classified as symptomatic and asymptomatic patients.
Mm-hmm.
Asymptomatic patients are being given the choice of staying at home for quarantine,
Mm-hmm.
or they can stay in the hospital itself. and symptomatic
right.
patients are also being treated. And district hospitals has ventilator facilities.
Okay.
Now all the health workers are being given PPE kit, gloves, all the facilities in rampant amount. And I have seen that in the last 6 months, the awareness in the public has also increased. About 90 to 95, about 80 to 85% of the community is now following sanitization, social distancing, and wearing masks. It has become the new norm.
Yeah,
And
of
10 to
course.
15% we need to educate them.
Right.
Lastly, I would like to tell that definitely we all can fight COVID-19
Yes.
by following
That's the
social
spirit.
distancing,
Yes.
wearing mask, and sanitization. I think that this itself is the vaccine until
We
proved
find
vaccine
one.
is available. Yes, ma'am.
Correct. Yes.
Yeah.
That's wonderful feedback, Pavitra. That's like really good to hear.
Thank you.
That you're speaking so highly about, and so are you enjoying it?
Yes, ma'am.
Getting a lot of
I'm
experience.
Yes, ma'am. I'm enjoying it. Yes, ma'am.
Excellent. And I mean, who doesn't enjoy working with babies? Of course,
Hello,
it's a great experience,
Yes.
and
Yes, ma'am.
definitely. And so, is there any, favorite of your game or a toy that you would like parent should follow to keep their children busy? Jenga, maybe TV games.
I'm telling stories.
Oh, there we go. We got a new idea now. So everyone have to come up with a new story,
Yes,
and
because
Cinderella and
parents as well
Snow
as
White is a old.
children will be involved.
Excellent. Thank you for that suggestion. So I'm
Yes.
curious to ask what Dr. Basaraj is going to suggest.
Yeah. Actually, I think so. My children, one is nearly an adult. He is 19 years old. Is attending his first year medical school, and my daughter is 12 years. So they are both at the cusp of they are adolescent, and one is adult. So
Keeping you busy.
yeah. So during the lockdown period, like what we did was we used to in the home itself we used to play the traditional games like checkar using that
Oh
tamarind
wow.
seeds and everything.
Bring
Right.
back
So
our
we
traditional games.
Right.
Yes.
yeah.
Yes.
So those
Totally.
things, the traditional games and everything, all four of us. So that and my daughter used to have her Ludo like inbuilt Ludo games. So
Right.
it was quite a fun period of the lockdown period.
Lockdown. Oh yes.
Definitely. And
That's a
now I
wonderful
think so. Even,
suggestion. Yes.
yeah.
Yes.
And second thing, now even is my son's classes are not there. I sometimes do the teaching for him.
Okay. Wow.
Already
But
started
it's
his
a
first year,
privilege,
which is
definitely.
yeah, definitely. I think so. Even it is learning for me also.
Oh,
So
of course.
definitely,
Revision
definitely, both are benefited, and
from that.
also we have spent a quality time with them.
Thank you so much for suggestion.
So
So
Basaraj,
Dr. M. Patil, yes,
Yeah.
go ahead, Dr. Kapoor.
no,
Tell me.
Basaraj, you have to train all of us, not only the physicians.
Yes,
No,
definitely.
no, no. My wife is the big. My wife is the better master than me, sir.
No, next
Well, one
online
thing
class
I
will
want
be
to
Basaraj.
say is all these children are so good at that, like what they do. And I think we must learn from them because no matter how good we are, some of them that, we just still have to lose to them. That's the only way to learn. So that's a great suggestion. So Dr. Patil, tell me, MM Patil, what is your solution? Quickly.
COVID has given opportunity not only for kids but for parents as well. Earlier, she is my daughter. Earlier, I only knew that in which standard she was studying. Now, during the COVID season, I understand her better, her hobbies and all those things. Now she has become perfect in all online
You
teaching,
have to learn.
and she has only set up
Yes.
me. And during these 4 months, I have
Right.
learned so many indoor games. And she has taught me so many games, and I have taught some older games like Chakra and all those things to her. And
Right.
really were enjoying with
That's
her.
awesome. Dr. Shailesh, do you have any suggestion at all? I know your student already gave away your secrets.
Yeah. I can only suggest what I have experienced at my home. not only music, as I said earlier, but we expose them to craft, to cooking. Then we even expose them to our Indian, like they are now well versed with artis. So since Lord Ganesha is at home now, they are reciting all the artis. They know the method to do the puja now, and even
Time to learn.
other yes, shlokas, they are also well versed.
Wow,
So
that's nice.
going to our roots, it this COVID has given us an opportunity
Opportunity,
to
right.
expose our kids to those traditional values, which
Right.
we could not have been able to do without
Excellent.
COVID.
Well, awesome. See, I mean, look at the amount of suggestions that we got, like from all of you. That's so wonderful, and I'm very sure that we have be a kid with a kid, and like play with a lot of those old time games just to introduce, and then learn and go back to roots and tradition, create a story, and like it's amazing that how much ideas that we have that we can all share, and it's a wonderful suggestion from all of you, and thank you so much. So we have a few more minutes, and then let me just ask this question before we wrap up. Is I know unfortunately we were not able, I mean, Dr. Krishna, can you add Dr. Shadab or Neha by any chance? I know that we are trying, and I think because of the internet issues that we're not able to connect with them, unfortunately, but even if they can hear us, they can just talk, if not the video. So that'll be
Yeah, I
an
know. Just
issue.
as a audio
Yeah,
call, maybe we can
audio
do the
call
audio call.
also. That'll be
Yeah,
great in case if they can
yeah,
come and just join us.
right, right.
It'll be a pleasure because we
Yeah.
definitely want to hear from them. So I know that we all are so hopeful about this vaccine as such that we are talking about, especially that we talked so much about the safety of the newborn, and the what is your experience handling these babies? Like there must be very stressful thing that's going on, all of you, when you see those coming out as an infected baby or infected mother. So how do you handle this? I'm going to start with Dr. Kapoor. I know that you are a neonatologist and you handle this one every day as a like a professional. And so tell me, like just share your experience a little bit.
Yeah, sure. So the question was more on the immunization for the
Yes.
newborns, you're saying?
Yes, and
Yeah.
also the like the day-to-day experience, like hands-on experience that you have, like you just enter that your zone, so called, like every day, your typical day. That how does it go? Like you handle like infected newborns or mothers, and like it's a lot of different things that you face every single day, especially during this period of time. So share your
Yeah.
day-to-day routine with us.
Yeah. So NICU is a very dynamic place. It's an intensive care. So you can have one baby who is stable. The very next moment they call you, it can be like a really sick baby.
Yes.
Unfortunately, we are a different breed of people, like, intensivists. So as all the faculty are, so we have to, at the any time of the day, even like 3 in the morning or 3 in the afternoon, you get called. So you have to really run and take care of the babies.
Right.
So it's a life, sometimes, it's life or death situation. That's one side. But on the brighter side is, we deal with healthy newborns also, newborn babies. So we get to see those newborns, and for the pediatricians, those who attend deliveries, they get a chance to see that baby from birth all the way going into the adulthood. So they can shape that baby's life or the child's life. So that's the joy the pediatrician can have compared to the adult physicians. I mean, I will let others share also
Yes,
in
thank you.
view of time.
Yeah. So Dr. Basiraj, tell us, like, how positivity that, like, you have to enter that facility every day morning, like, when you go there. What does it take?
Yeah, it is every day morning is the same morning for me, because I have both what's a maternity and neonatal setup. My wife is a gynecologist, so every day, like the same newborn rounds and everything takes place. What a good thing about when you point perfectly towards COVID, As such, COVID is not much prevalent in case of a neonates and even in a maternity also, what we are seeing routinely now. So we were anticipating a lot of mothers having a COVID positivity. That amount is not coming up, and the newborns as routine care we are providing. Sick newborns, yeah, that part as Kabur sir has told, we are maintaining the same level of treatment for them also.
Right. Thank you. Dr. Patil, MM Patil, so what does it, like, I know that you are a part of
Anu,
WHO,
just a quick thing,
and I'm
yeah.
very
Anu,
sure we have so much of a thing going on.
Anu,
Yes, sir.
I think Neha is on. Let me just put her on. Neha, can you hear Anu?
No, I can't hear her.
Yeah.
Neha, can you hear me?
Can you hear Anu?
Yes, ma'am, I can hear you.
Oh, excellent. We can talk. Yes. Well, thank you so much. I'm so sorry. The internet is giving a little bit of obstacle to come have you live. But just quickly tell me that like what do you think before you even enter the hospital every day morning? Like what kind of a positive energy that do you need to take to enter there every day?
Okay. Ma'am, first I would just like to thank you for the opportunity, and I would like to thank Dr. Prakash sir for this opportunity to speak on this platform.
You can barely hear her. Yeah, that's okay. Yeah, go ahead.
Yes. So we've been working in the front line against COVID for the last maybe around 4 months. So, so there's one thing that I want to close with is there's no point in being fearful about the infection. We have to fight it. If it's not us, then who will fight?
Right.
Fight the infection? Who will help PPS? So, right now, like I know that I'm giving my best. I know that I am taking all the precautions that I can. So, despite this, if I do fall ill, I mean, ultimately, we cannot help it. It's just, I feel to a certain extent, it's a bit of destiny involved. But I feel to the best extent that we can work, we can help people, we can help our patients, and we have to protect ourselves to the best extent that we can do it, we should do it. The rest, we just give it to the hands of God.
That's great, and hats off to you for being so positive. And I think, like, even though we could not, like, I don't know if everyone could hear, but I could hear you, like, most of it. And then appreciate your commitment, and like, and please keep doing what you're doing. And I think we would love to have you back sometime also with your more experience. And definitely, we can have a very specific discussion on what you just said. So. It's a very innovative that we should hear the experiences of all of you who are newcomers to this field. So thank you so much. Really appreciate it. Thank you. Just stay on, and so that you can hear all of us. So Dr. Shadab, tell me, like, what is your just to take on, like, what kind of a positivity that it takes. I know that you take more than what you can at this point. So what does it take for you to just become so positive to give back where you work? Unmute yourself, please. Yeah, go ahead.
Yeah, initially when we started hearing news of these cases starting in China, my reaction was to just think that it will be limited there. And then when it was declared a pandemic, and then it came to India and it started spreading, the first reaction was fear, and that was natural for all of us.
Right.
But then over time, I started realizing that when the lockdown was in force and we could hardly see people outside, but daily me and my colleagues used to go out and enter the hospital and start working. I started getting this feeling of being in a team like the firefighters. So we would run inside the building that was on fire, whereas everyone was running out. So that I felt was touching on the essence of being a doctor. That it is in these moments that we really realize that being a doctor is a calling. It's not a source or a means to a livelihood.
Sure, that's a very great perspective of what have you put it for this, and definitely needs a commitment, and the way that you look at it have to be different. So thank you so much for your feedback. Um, so I'm going to have Dr. Fatehpur just tell just like just to wrap up. So what do you think that like I know it is not going to end very soon either. So I know that we have to keep fighting. So how do you keep yourself so positive to enter that every single day?
See, we have joined this profession for serving the people
Right.
in the health field. So
Mm-hmm.
we cannot run away from our duties. So we
Absolutely.
have to work, and the people, the society needs the healthcare professional, and
Absolutely.
so it is our job, and we have to do it. And there is no running away. And the more we serve,
Correct.
definitely it will have positive impact on us also.
Absolutely. Well, thank you so much. Dr. M. Patil, what is your intake on that?
Madam, even I had tested positive for COVID. And after this COVID infection, I became more comfortable in handling these patients. Being in the hospital, not only you should be enthusiastic, your staff should also come forward and treat the children. And I like to start the day with seeing the newborn. The fact that they make you feel comfortable, and you follow
Happy.
from their birth to happy, and you like to see the newborn to start. I start my day at 7 o'clock, so I start the day with newborn examination,
Nice.
so that I'll be happy throughout the day.
Right. That'll be an awesome message. So just look at that smile and keep yourself going. That's a great one. Dr. Basaraj, what do you say?
Yeah, it's the same thing what everybody was
Just
telling. Yeah, it is. I like it is a privilege to
keep
be a
going.
pediatrician. Yeah, being a pediatrician it itself is a privilege, and you are handling the best creations of God.
Right.
So that positivity and everything we take it to daily this one. So definitely it's really a gratifying experience every day. And I have to thank Kabur sir for getting all of us on board today, and sharing our views
So we can
to
all share
the
this wonderful
yeah, definitely.
information and
Yeah,
support
yeah,
each other. Yes. Dr.
yeah.
Shailesh, what do
Sir,
you think? I want to hear from you also quickly before we wrap up.
Yeah, uh, I agree with everybody. One thing I would like to say: when the nation is at war, the soldier cannot sleep.
Right.
So it is our duty to work. And earlier, with every one of us, we had apprehension about managing. But now, with the time, we have gained that confidence, and
Right.
everything is in place, and confidence that we can manage any child with whatever severity, and come up with a good outcome.
Correct. Well, thank you so much, and I have to give it to you all because I know that you are special than any other profession, like the specialty, because you literally read their minds. Because they, I was actually earlier talking to Dr. Kabur and telling that like it's almost being a veterinarian because the patient cannot speak, and then you just have to read their mind and treat them, and it's one of the best ability that you all are blessed with when you chose this specialty. So thank you so much. I think we have a great session. And Dr. Kabur, before we leave, just briefly, like for a quick minute, so can you give your message to all the audience, because I know that it's very important, like what all you have suggested about the safety and also the suggestions, the medicine, vaccination, and also keeping the kids busy with a lot of information that we discussed. So just one more last message from you.
Yeah, definitely. So again, I would like to thank all the faculty here and all the postgraduates. They are doing an amazing job. And again, thanks for iAsia TV and Anu, you also, for bringing us together and having us share our information. So what I would say for all the audience is COVID is not going to go away. It's going to stay here. So fear is not the thing that we need to spread now. So it is more of our awareness and common sense. So those things are extremely important. So we have to work towards what the things are going to suppress the COVID rather than, so listening to other things. One more thing that I would say is be aware of these WhatsApp messages. Okay, negative messages.
Yes.
Okay.
Yes.
So
Totally.
try not to spread them just to gain the number of messages that people are saying. So again, as the Dr. Shailesh Patil said, we are the new soldiers. Healthcare professionals are new soldiers. You are on the front line. You will be infected at some stage. So you have to make sure that you have the courage to recover and then continue to provide the treatment. And then pregnancy, newborns, and children. So they are all precious, as are elderly people, anybody in the community. So we have to make sure everybody is treated equally, everybody is supported both physically, emotionally, medically, economically,
Right.
and we must support each other. So as our Train and Help Babies logo is, together we can win this war, and it's a teamwork. Okay.
Well,
So I
thank
think
you.
Neha is
Thank
on.
you so
So
much
maybe you can just
for a wonderful that message.
your last.
Here,
Excuse me.
lot of many people were saying just SMS, SMS,
I know.
social distancing, mask, and
Yeah,
sanitizing. These
yes,
are the
And
three
Right.
things.
Right.
So
SMS,
you
yes.
keep doing SMS,
That's a
SMS.
great way to
That is
message.
the
yes,
thing.
Yes,
yes.
totally.
Yeah. One thing I would
Anything,
say,
anything. Yeah, go ahead.
one thing I would say is it should come to such a point that we ourselves should be tired of saying, "Oh man, I have said it 100 times." I think once we get tired, that's the time the other person will start hearing it. Okay.
Right. Well, I think there is no such thing as a tiring, because when it comes to, like what Dr. Shailesh said, being a soldier, so let's keep moving. It has to happen, like no matter what,
Right.
regardless, and it's unconditional. So that's what we're going to follow. And I would like to thank Dr. Krishna for helping to run such a great panel, so meticulously, and for on behalf of Asian News. And thank you so much for all, Dr. M. Patil, and also Dr. Basiraj, Dr. Kabur, Neha, Dr. Neha, and Dr. Fatehpur, and also Dr. Pavitra and Shailesh Patel. And I think we don't have Dr. Lade and Dr. Shadab. So I really, really appreciate all of your participation in this one, for making it such a great panel, and really looking forward to have this again. And thank you so much for your services as well. And do let us know on behalf of our Asian News channel, or any help that we can contribute towards any of these projects that you're going to do. And I wish you
Actually,
all the best
last one,
to everyone
last
who
one thing.
joined
Can I
today.
say, Dr. Mr.
Yes, go ahead, Dr.
One thing?
Vedapur.
So actually, I thank Dr. Prakash Kapoor sir and Train and Help Babies. Okay, they have done lot of things
Work.
Yes,
to the
we are very
organization.
much aware
Okay,
of it in Dallas. It is the favorite project
so
for a lot of people here. Yes.
so actually, he has given many instruments and saved lot of babies. Not only
Absolutely.
saving them intact survival is also very important. So I
Right.
thank Dr. Prakash Kapoor and Train and Help Babies for that.
Let's keep doing, Dr. Vadefur. We will be always supporting you, and definitely let's keep this one and keep moving, and then just have the step up as we go further. As soon as we get over this COVID, that I'm very sure that the bright side is still ahead, and let's keep towards, and let's keep our positivity. So thank you so much for joining. Really appreciate it, and I hope you all enjoyed. And also thank our viewers for joining today. And keep watching. And this is Anu from Global Gupshup, Asian News presentation, coming every Saturday or Sunday on a weekend with a more informative session for you. And thank you, pleasure having you all. And thank you for your great continuous support. Thank you so much.
Thanks a lot. Thanks
Thank
a
you
lot.
so much.
Thank you.
Thank you. Thank you so much. Thank you.